Welcome to Intelligent Medicine, America's foremost program on health, medicine, and nutrition, featuring the latest on both conventional and alternative therapies. Now, here's Dr. Ronald Hoffman.
Welcome to Intelligent Medicine. I'm your host, Dr. Ronald Hoffman. And we got lots to talk about this weekend, so stay with us this hour and next. And you can join in by calling 877-726-8255. That's a number for questions. And we got lots to talk about because there have been lots of health stories this week. And so let's catch up on some of them. If your doctor's not happy, it's not likely you'll be a happy patient. And there's some bad news from a new study from the American Journal of Medicine. And really stark statistics here. The headline is, Doctors Became Overworked Robots. Physician burnout jumps dramatically in 3-year study. This summary was published in Study Finds. Physicians may be more stressed than ever, according to a recent survey that found that half were thinking about hanging up their stethoscopes for good. Now, I'm going to preface this by saying this does not apply to yours truly, because I really have enjoyed my medical career. And yeah, there's sometimes, there are hassles associated with being a doctor. There's paperwork to do. But to a large extent, I'm off the grid when it comes to much of this because I don't work for a hospital. I'm in private practice. I've structured this so I don't have electronic medical records. I'm not accountable to insurance companies. If you come to see me, well, fine. And if you want to file for insurance, it's likely that you'll get some insurance. But I don't key my practice to whatever procedures or types of visits will garner the most insurance reimbursement. And that's the predicament for a lot of doctors. New research, they say here, continues to demonstrate the demise of doctors, with burnout levels jumping dramatically over just a 3-year span. From 2011 to 2014, physician burnout increased from, it was already pretty high in 2011, 45.5% to 54.4%. That means the majority of doctors are burnt out. And it's not about their home lives, according to this study. It's their jobs. 3 key factors are accounting for physician burnout, according to the research. First of all, the traditional doctor-patient relationship has been eclipsed by the relationship between health insurance providers and patients. In other words, who are you working for? Are you working for the patient, or are you working for the health insurance company or Medicare? Companies are standing in the way of fast and appropriate treatments ordered by physicians. So it's almost like, doctors these days, if you want to do something, say you're proposing surgery, or proposing an operation or a course of therapy, you got to sing for your meal. Or even a blood test, even certain tests. Maybe you want a test. It's a rather esoteric test. It's going to cost $200. The patient doesn't want to pay for it, of course. And so you have to write an exhaustive treatise to the insurance company, who's likely to refuse it, in order to get the test that you need to make the diagnosis. The second factor, doctors are feeling more cynical as a whole because patients don't expect continuity of care anymore, and they routinely change doctors. And also, it's not even about doctors, it's ask your healthcare provider, because many hospitals and many practices are using physician surrogates, very fine people, nurses, nurse practitioners, physician assistants. But if you go to a group practice or a clinic, you're not likely to see the same doctor every time. And finally, general lack of enthusiasm for work accounts for some of this burnout. Doctors are inundated with numerous extraneous burdens that collectively rob them of the joy of medicine. Yeah, we went to medical school to, treat patients, to serve mankind, but ultimately we find ourselves stuck behind computers. The 5 transformational practice events in medicine that occurred between 2011 and 2014 that contributed to the spike in physician burnout. Here they are. Rising drug prices. So it becomes increasingly impractical to prescribe a course of treatment for a patient. It's very frustrating. Purchases of medical groups. A lot of the folks that I meet at my medical school reunions, they started out in private practice. They got bought out by hospitals. Now they're employees instead of independent practitioners. The Affordable Care Act has been, it's helped some people, but it's also put a lot of constraints on doctors. Something called pay for performance, in which providers are offered financial incentives to improve quality and efficiency. That means that, in effect, they're being paid to save money for the insurance company, to limit care to patients, and to restrict patients' access to tests and treatments that may ultimately help them, but they're deemed expensive or unnecessary. And also, finally, and this is a big one, mandated electronic health records. Go to any hospital and look for the nurses and doctors, and invariably you're going to see them sitting in front of computers, not sitting or standing at the bedside of patients. They're not happy, and their patients aren't healthier as a result, unfortunately. So that's a big problem. Study published in the American Journal of Medicine, and if your doctor's not happy, it's not likely you'll be a happy patient.